Today I'm going to be doing a Foley catheter on my patient. So I'll walk into the room, I'll introduce myself, verify that my patient is the same patient that I have orders on, ask her name and date of birth or any two identifiers. I'll provide her with some privacy, and I'll wash my hands, put some non-sterile gloves on before I adjust her into the frog leg position. Once I get her adjusted to a frog leg position, I'll get my kit and I'll open it up on a side table. So first I'll open my flap away from me, the sides, and then towards me. I'll square up my box. I'll get my sterile gloves out, put them on the side, and I'll grab my drape with 1-inch parameters. I'm going to put the shiny side down, go right under my patient. Excuse my area. Okay, take this drape off, it's for a male. Then I'm going to don my sterile gloves. Only touching 1-inch parameters on this as well. I'll start out by grabbing the flap of my first glove, inserting my hand into it. Alright. Then going under the flap for my second glove. Alright. So now I'm sterile and I can touch my box. So I'm going to open my sticks. These are my pretend sticks for today. I can take my lube and I can squirt it into the corner of my box. Alright, I'm going to take my Foley and I'm going to unwrap it carefully. Wrapping it around my fingers. Okay, and I'll put it back down into my box, keep it nice and sterile. I can chunk that. Okay, I'm going to take my water and I'm going to attach it. I'm going to put my swabs back on top, and then I'll move to the patient. Trying to make it where y'all can still see. So first I'll take my hand and I'll spread the lips apart so we can find the urethra. I'll take my first swab, go furthest away from top to bottom, swab down, dispose of my first one. Second one, I'll go closest to me from top to bottom. And the third one, I'll go in the middle, all the way down. Okay, I'll get rid of that. Then I'll get my catheter, put the lubrication on. I'll tell my patient to bear down like they're trying to use the restroom so that it'll go through smoothly. We'll insert it in. Alright, and I'm going to hold it firmly with my other hand. I'll inflate the balloon. And I'll quickly pop it off so that it doesn't come back out. Alright, and I'll give it a small tug just to make sure that it's in there good. And so you guys can see, I'm just going to turn it. You can see that the balloon's inflated inside of the bladder. Kind of cool. Alright, so then I'll take these gloves off and I'll just don normal gloves. I'll take this out of the box and I'll attach it to the patient's bed, the lower part that doesn't move, and then I'll secure this with a stat lock. Alright, so all this is gone. Alright, and then to remove the catheter, I'll just take my syringe, take a clean syringe. I'll get the water out of the balloon. And I'll tell the patient to just take a couple deep breaths. Now inspect the end of the catheter for any drainage. And then just dispose of this catheter.